Good morning. This is a very large room. What are the telltale signs that you're dealing with a multi-system problem? Well, everyone is involved and no one is in charge. So homelessness is my entry point into improving population health. And it's a classic multi-system problem. It involves housing, health, and mental health, veterans issues, family breakdown, substance abuse, criminal justice issues, aging, and more. So this morning I'll be talking about how to work with communities to take a new kind of action on homelessness and population health, to take action to solve multi-system problems that no one institution can solve alone. Now this means learning how to build a team made up of the various systems and actors that need to work together, not just to end homelessness and to improve population health, but I may add, to repair our communities. So I'll be speaking about our 100,000 Homes campaign, which was inspired by the Institute for Healthcare Improvement's 100,000 Lives campaign, which I'm sure many of you followed. And that will be the way I hope I can unpack how we're working, which I find to be so instructive, and we're certainly evolving our approach all the time. But also I hope to give you a window into what we see as the new possibilities. This is frankly about something that's emerging, and I think a lot of places that we see. And it's the contours of a new, more coordinated way of problem solving that can be applied not just to homelessness, but other complex problems. So as a starting point, at the heart of our work at Community Solutions is the belief that institutions need new and more coordinated ways of working together to achieve better outcomes for the most vulnerable people in particular. And I'll tell you a story to make the point. We began our work about 23 years ago, developing housing programs for the homeless. They were very fine and continue to be very fine programs that integrated affordable housing for a mix of income groups, including the homeless, health and mental health services right incorporated into the building. So it really made it very easy for people who are dealing with multiple challenges to overcome them and to remain on a stable and healthy path. Importantly, not only were individuals' lives improving and health improving, but we were able to demonstrate to public sector funders that by coordinating the supports around housing for people who'd been homeless and in and out of hospitals, that we were able to achieve profound savings in these public systems, and particularly in healthcare. We were able to document multiple benefits, and we're feeling incredibly good about our work after many years of growing proof points that we had through our programs an important and scalable solution. We were winning awards, our work was being replicated, all seemed good, but a series of incidents began to trigger for us that all was not well, and we had not really solved the bigger problems when it was brought home to us very pointedly that we were continuing to walk by some of the most vulnerable people who are homeless on the streets of New York. And in particular, there was one incident with a very frail, long-standing homeless woman living on the streets of Times Square, ending up at our building and making it clear that the fact that people had been offering her blankets and food and warmer clothing on the street had never really done anything to solve her fundamental problem, which was finding this woman a home. And it might seem strange that we, who had a problem-solving attitude around homelessness, had sort of bypassed this whole most obvious dimension of the issue, those still living on the street. But I think it's illustrative of the mindset we can get into, where we have something that has a strong evidence base and we know for whom it works, and we tend not to think of the group for whom it doesn't work yet. And so what was also striking about this particular situation is when you think about homelessness, it's one of the most vulnerable social issues that we have. And so here is a situation of this woman and many others on the street who weren't in our programs, for whom, you know, those who were living in our programs were doing well, but this and many other people on the street were actually known to all of us working in that particular part of New York City as people in need, but none of us had actually claimed responsibility for doing something about those particular individuals and their apparent need for very significant and urgent care. And in fact, in speaking to this woman who, when we moved her into our building, just became such a source of wisdom and insight into the larger system that had failed these individuals, it became clear through her description of her many years on the street that she was relying on so many different organizations to do little bits of reactive care that no one group ever had a clear picture, and no one group ever took responsibility for helping her get into a stable situation. And let me stress, we were implicated, my organization was implicated in all this too. I mean, here we were operating a very, successful by many accounts program, but we were not actually looking beyond our bounds to see what was the larger picture. And in fact, in that, I could see at the time that our housing programs weren't all that unlike a very traditional hospital. We had an enormous building with tremendous resources inside, but we were only set up to help the people who had the wherewithal to come knocking on our door and who met our intake criteria, which just happened to exclude the most vulnerable people living on the streets of New York City. And so clearly, a new approach was needed. And clearly, the existing systems weren't set up to respond to the problems and really solve them of the most challenging cases. And without a coordinated effort, it wasn't just simply a question of new resources, because what we were able to see is that this woman and many of those living on the street, in fact, massive resources were being spent reacting to their problems. The challenge was coordination and how we could work together in a new way. The hospitals, the people doing outreach work, groups that had housing like our organization. And so it was our introduction really to the fact that for us to move toward a real solution to homelessness required us to redefine the problem and acknowledge that it was much bigger than housing and mental health. It was our introduction to the world of multi-system problems. And when you are ready to confront the fact that that is actually at the root of most of our challenging institutional problems, it is no one's job to take on these problems. So you have to make it yours. And so it was a bit of a bumpy road, but we began by convening a series of conversations with other organizations working in homelessness in our immediate environment. We were hoping to spark some spontaneous collaboration, just that people would say, oh, I can do this, I can do that. But what was very clear, that despite everyone's good intentions, no one even believed it was possible to work differently. No one believed it was possible to solve these fundamental problems, and we'd all been pretty conditioned to simply respond to them as well-intentioned professionals. And so probably the critical moment in our journey began with realizing that none of us working in that system of human services and responding to homelessness and in and out of the hospital and trying to reorganize emergency responses differently, none of us could actually see past our boundaries. And I was fortunate to have the opportunity to hire someone from a totally different world. And it's a practice that we have really embedded in our organization ever since. I hired someone who's a military intelligence officer, someone who spent not a single day thinking about homelessness or human services issues, but knew how to approach a problem differently. And with that new member of our team, an amazing woman named Becky Canis, whom you'll see in a video I'll show at the end, we were able to actually restart the conversation by taking a different problem-solving approach. We ended up with only 4 organizations willing to work with us at the beginning, what we kind of called the Coalition of the Willing. And it wasn't the traditional organizations who worked on homelessness. It was the Midtown Community Court, it was the Business Improvement District, and it was a local church that had a soup kitchen. And they were willing to rethink the nature of the problem with us. We had folks from our organizations go out not from 9 to 5, Monday through Friday, which is when most outreach to the homeless happened, but overnight, when people were actually quite visible in terms of who was in the most extreme need. We came to see that There were, while there were about 55 people in that core area of Times Square who were homeless every night, there were only 18 who were homeless day after day. And so my colleague with the military intelligence was like, well, what's different about these individuals? And so we started getting to know them by name and found out that once we started specifically working to place those individuals directly into housing, getting rid of all of the typical barriers and processes, that actually led to not simply 18 people being housed and a difference of 18 in homelessness in Times Square. Within 3 years, there was an 87% reduction, which is held to this day, and a 43% reduction in homelessness in the rest of Midtown Manhattan, which had been the area of densest concentration of street homelessness. So this notion that we basically had to rethink the system in order to change it, and that this was nonlinear. We would begin working with certain individuals and other people's behavior would change, made us realize that we were onto something very powerful and important, and that the tools we'd been using were simply inadequate to do the work differently, much less explain the effects of this new approach to coordination and very disciplined problem solving that used techniques that we were borrowing at that point just from the military. And so the next step in our journey was we began getting calls from other cities who heard that we were making this progress on street homelessness in New York, which had seemed impossible to people. And so we, at that time, had also become very enamored of IHI, and aren't we all, and realizing that the world of quality improvement and improvement science was probably our next important step. And with the partnership of IHI helping us to think how to adapt the 100,000 Lives campaign to homelessness, we launched in 2010 the 100,000 Homes campaign. It became a US-wide effort that ultimately involved 186 US communities, a community defined as anything from a county, like a region, to a city. And we initially recruited the cities where we knew colleagues who were already expressing curiosity about a new way of working, and invited them into a learning network with us. We helped each of these cities to build a collaborative multi-sector team, which involved minimally people from their mayor's office, people from the healthcare agencies, the Veteran Services Agency in that community, the housing authorities, and the not-for-profits. As in Times Square, we sort of accelerated the process that we had evolved there to help those communities conduct something that we had at this point learned to borrow from public health, which is to create a by-name registry of everyone living on their streets over a compressed time period of a week. As a result, and as a byproduct of great benefit to the country, have now a massive national database from which to draw lessons and information, especially on health and life course issues, and to identify trends that are continuing to help us solve homelessness at its core. Now we grew the movement through a public engagement process and a movement building process with all of these cities and the change agent leaders there. We had weekly emails and a Facebook group, a steady drumbeat of media stories, and we began more and more to be able to distill as each new community joined us, and we began to see results in what was working, that we needed to set specific targets for what communities needed to be doing in terms of the percentage of individuals who are homeless who would be housed every month, and in priority order based on the most vulnerable, now that people had that by-name registry with health information that showed people's health vulnerabilities. We began a whole system of rewarding and celebrating the real leaders, not only those who were getting the strongest results numerically, but those who were really pushing upstream, willing to take on some of the questions that were of importance to all of the groups in the movement. And by the end of last July, which was the deadline for our 100,000 target of getting 100,000 of the most vulnerable homeless people in the United States off the street and into stable housing, we were able to announce by then that we had housed collectively this massive effort of teams in so many cities we had collectively housed more than 105,000 long-term homeless people who'd been on the streets of their city more than 7 years on average. And that number included over 31,000 veterans of our military service. And we were able to document with third-party sources that represents a collective savings year after year of more than $1.3 billion, largely in avoided healthcare costs. So, lessons learned. Once you've decided to take responsibility for a multi-sector problem, what do you need to help you do it? Well, most people assume that it will require lots of new resources. But what we've learned is that it's actually about finding a way to teach multiple systems to work together to optimize their existing resources. So, in city after city, we would pull together the local team of these different agency and organizational actors and help them to map out the way their system actually functioned. And none of these groups had ever thought of the work that they needed to do together as a system. There were just different kind of steps to get something done. And once communities mapped this out, they would realize to their horror that they had sort of designed something, or something had evolved that was never built to work. You could see on this map, and I think this was taken from Los Angeles, that there are all of these different system blocks. Those yellow stickies relate to moments where people have to meet together from different organizations to make a decision. And historically, that happened with someone would send a fax or an email, and it was unclear what the next step was, and there are no time limits or expectations attached to it. There are other blue markers where money had to change hands, a lease deposit or some type of payment for a copy of a birth certificate. So all of these jamming factors, and what community after community came to see once they realized what they had sort of inadvertently built was that their sense of impossibility around solving homelessness was directly related to the impossible system that had actually accreted and evolved. And so what we did with these teams is we got them together as a next step and said, design something that would work. And now these individuals who had taken, on average, over 3 hours to even figure out the way their system was functioning, could figure out what should happen within about 10 minutes. But then we asked them a better question. What is keeping you from working in that way right now? And you'll see there's a blank column there. Nothing was really what was keeping them, other than the permission to work that way. Now, importantly, the folks we brought together were not the chief executives of organizations. It was the line workers, the people who actually had to process the paperwork, the people who had to go out to the street, the people who had to find the apartment. And it was powerfully liberating to actually share with these line workers the tools they needed to do their work effectively and well, to actually enable them to connect with people at different agencies who had different resources that had to align in new ways. And in fact, what came out of this process was an over 300% improvement in people and these teams' housing placement rates, again, using the resources they already had. So why does that matter? Well, now more than 105,000 long-term homeless people are housed. And in addition, these communities have what we like to think of, and quoting Joe McCannon, formerly of IHI, reusable infrastructure for solving other community problems. And so we have recently, as of January, launched something we're calling Zero 2016, which is was a by-invitation effort, which is involving 85 cities now, 85 communities, including 4 entire states and the District of Columbia, to get to zero veteran homelessness in all of these communities by the end of this year, and zero chronic homelessness, meaning long-term homelessness, by the end of next year. And this is just a massive and accelerated quality improvement effort around helping these communities perform at a high level with the resources they have to get this urgent work done. And we're also, through another part of our organization, now able to respond to requests we've received from other cities and countries internationally. So we're beginning to work with Canada and then with about 5 cities in Europe on how we can adapt these campaign methodologies to helping those communities end homelessness. But I'll also say, and this gets to the population health component of our work beyond homelessness, that this way of working, we think, has very powerful implications for the preconditions to homelessness, which one finds too often in the poorest communities of our cities. And so, while we have, for instance, in Los Angeles and many other cities, neighborhoods like Skid Row, places where poverty, street homelessness has been concentrated for many years, and people have kind of gotten accustomed to walking by gentlemen like Ed Givens, who was one of the first people that we worked with to house during the 100,000 Homes campaign. But Skid Row has about 5,000 individuals living on and off the streets in missions and very rundown buildings. But this is what's possible. That was Ed after 6 months in housing. And so in neighborhoods like Skid Row and in neighborhoods around the country, we are seeing that the chance we have in front of us is not just to accelerate housing placement rates, but to go to the seedbed of a lot of those social inequities and conditions that set individuals and families up for failure that you often find, at least in the United States and in many other countries, in neighborhoods that are dominated by public housing, that have the highest rates of poverty and all of its related ills. And so the design principles that we brought to homelessness, we are now using in these public housing neighborhoods and in other areas of public health, including where we see significant overuse of the emergency room coming from these poor neighborhoods. Here's a case in one of our Hartford, Connecticut efforts where we're working with local hospitals to identify the high users of the emergency room and to put together the community resources that can help a young mother like Sequoia there, who'd been in the hospital repeatedly, to actually get what she needs, which was not another visit to the emergency room, but what she said mattered to her was help with childcare, a safe and functional apartment that actually had running water, and some of the challenges around getting a stable enough job that she could support her family and not be in a state of current crisis that was exacerbating her stomach conditions. And so these opportunities to problem solve with community teams, we think have such important and hopeful implications for our population health work. Because in the case of Sequoia here, who is representative of so many individuals who are on the path to homelessness and who are leading lives that can be dramatically improved in our country's poorest neighborhoods, all of the resources that were needed to help her get into a new situation existed in the community, but were not connected. So it's the same kind of design challenge we see in homelessness and in the preconditions of homelessness. And if we can work differently in these neighborhoods of concentrated poverty, so much is at stake, not just people's health, but their ability to participate in the economy, the futures of their children. And we are excited to see that in bringing the tools that all of you working on quality improvement in healthcare probably understand, but have not had the same opportunity to see at work in the human services space, on which ultimately population health relies. All of the health care in the world was not assisting Sequoia and so many of these individuals in actually breaking through to the better lives that were available to them and the possibilities for stronger communities. So if you are to remember one thing perhaps about our story and what it perhaps suggests for the work that you're doing around population health or within your healthcare system, we think that the challenge ahead of all of us who care about these issues of social justice, care about these issues of population health, is that we need to help large systems function more like people. And we think that's the key, because people are naturally gifted problem solvers. At our best, we're adaptive, we're responsive to change, we work with what we have around us, we seek out new ideas, and we naturally make appropriate connections between people and institutions. And we're finding that tools from any sector can help and can build our skills as far as collective problem solving. And it's when we give into that temptation to turn our best ideas into institutions rather than stay with that adaptive problem-solving process. It's that move to institutionalize things too quickly and in ways that shut off that capacity for problem solving. That's when we get into trouble. You've all been there. Institutions are too often static and rigidly organized, and they're frustratingly siloed. They value stability, and they change slowly, and they always seem to need more money before trying anything new. Well, we think that if your institution could become a leader in your community in venturing into this multi-system problem-solving space, that actually holds the key to very different outcomes. And in closing, I'd like to share with you just the closing video from the 100,000 Homes campaign that we released when the 100,000th individual was housed at the end of last June, if I can get that running.
One of the characteristic elements of humanity is focus. Just being aware that there are human beings who are suffering nearby is very easy to allow your focus to pass that by. But if you engage in the fact that that's true, I think that most human beings do have an intuitive and immediate response to suffering that they want to alleviate it.
Everyone deserves to be housed. The issue isn't where they're going to be housed. Let's not get to that point yet. Let's talk about everyone needs a roof over their head.
Housing Authority of the City of Los Angeles.
Phoenix, Arizona. Greater New Orleans.
Houston. Fresno, California.
Prior to the 100,000 Homes campaign, it was difficult for anyone to think outside the box.
In many communities, urgency hadn't really been there around this issue.
We knew housing was the solution to homelessness, but nobody knew how to do it.
Homeless and chronically homeless individuals, and veterans in particular, that's a problem we can solve.
The City of Phoenix proudly announced that we got to functional zero among chronic veterans.
We've been able to bring down homelessness by 80% since 2007.
We saw the point-in-time count numbers, and there was this decrease.
Those were people that everyone would have said couldn't be housed.
I thought, double check the numbers. Like, that can't be right.
He's been on the streets 31 years. No way will you get him into housing.
How did we decrease it by 30%?
But we did. We did the impossible.
Take back your weather and bring me the skies. With a day so bright I can't open my eyes.
And now for the big news. Can I get a drum roll, please? As of right now, in just under 4 years, the communities participating in this movement have housed that's 101,628 of our most vulnerable neighbors, many of whom were at an extremely high risk for dying on our streets, are now safe in homes of their own.
I think being the part of the campaign, I don't think I said this, but you realize you're not alone. There are still people who believe that people want to be homeless. When you do house somebody and you do change someone's life, it makes it so much easier to bear.
Alvin is an Army veteran who for more than 20 years battled alcoholism, unemployment, and the physical dangers that come with life on the streets. But he never gave up on trying to get housed, and he never gave up on his hope. A few weeks ago, Alvin moved into an apartment of his own and became, as best as we can tell, the 100,000th American to come home as part of this movement. Alvin Haggerty.
I appreciate the simple things in life now, like having a kitchen, having a bathroom. A lot of people take that for granted. It's been a long journey, but I can say I made it, but I still have many miles to go.
We know for sure there's no person that can't be housed and there's no community that can't be ending homelessness. Just, there's no putting that toothpaste back in the tube, basically. You can't go back from there.
Thank you.
I can do it.